Today is a very proud and historic moment for our country. It's with great honor that I stand before you today as we gather here, not just to commission a facility, but to celebrate progress and to celebrate partnership and the promise of a healthier future for all the people of Kenya. It also gives me a great honor to warmly welcome our distinguished guest of honor, the Director General of IAEA, Brother Rafael Grossi. It's a good day for me because even last night at the airport I welcomed the UN Secretary General. And this morning I have you here. So I have been with the UN family since last night, 11 p.m. So it's good to have you here. And I told the SG that I'm coming to Mombasa. He's launching one of the biggest UN complex in Nairobi. I think Nairobi now will have the third largest UN conference facility after New York and Geneva. So your presence here today is a testament of your personal commitment and unwavering dedication to the IEA in improving lives through science, innovation, and global solidarity. Cancer remains a major public health challenge globally. In Kenya, it's among the leading causes of morbidity and mortality, placing a heavy burden on our individual families and communities, and above all, our health system. For many years, access to radiotherapy services has been limited and has been centralized, with many patients forced to travel long distance, often to Nairobi to receive treatment. This has resulted in long waiting times, as well as substantial financial and emotional strain. These barriers have resulted in delays in accessing care, increased treatment costs, and tragically poor health outcomes. But today we stand at a turning point. We begin to change that narrative. The commissioning of the Mombasa Radiotherapy Center marks a bold step towards equity in cancer care. It represents our commitment as a government to ensure that no Kenyan is denied life-saving treatment because of where they live. So this milestone could not have been possible without a very strong and visionary partnership we have with you. And today we must take a moment to truly recognize and appreciate one such key partner, the International Atomic Energy Agency. Under your exemplary leadership, Your Excellency Rafael, the IEA has transformed what was once a distant aspiration in the tangible reality of Kenya. Through your leadership, the IEA has gone beyond its traditional role of becoming a hope for cancer patients, not only in Kenya but across the developing world. You have supported us in expanding radiotherapy infrastructure, bringing treatment closer to the people. The IAEA has supported the procurement of modern radiotherapy equipment, including the linear accelerating machine for such centers like Nakuru and Mombasa. These machines are critical because about 50% of our cancer patients require radiotherapy as part of their treatment. As a result, Kenya is moving from a highly centralized system, mainly based in Nairobi, toward a regional cancer treatment hubs. As the PS said, we are now opening up the country. We are opening soon at Jaramogi. We are opening one in Kisii, building one in Nyeri, in Meru, and in all our referral hospitals across the country. You have supported cancer diagnosis. IEA support goes beyond machines. It has strengthened the entire cancer ecosystem, from providing the diagnostic imaging equipment to nuclear medicine support and the treatment planning system. This extends to supporting national cancer planning policy development and the quality assurance framework. And in order to do all this, that again will enhance our radiation safety and regulatory system. So you have invested in training of our healthcare workers, building a skilled and confident oncology workforce that you have seen today. I think the testimony of our two doctors from these two centers is a proof. So the IEA invests heavily in training and skill development. Kenyan professionals have benefited from the fellowship and the specialized training. Training programs cover the safe handling of radiation and the quality assurance, as well as site expert mission, where IEA deploys international experts to provide hands-on in-country training, and these engagements have resulted in skills transfer, improved quality and safety of cancer care. It has reduced reliance on external expertise and the development of a sustainable oncology workforce. You have also strengthened our regulatory and safety systems, ensuring that these technologies are used responsibly and safely. The partnership between the International Atomic Energy and the government of Kenya extends beyond the health sector. It goes into infrastructure, it goes into standards, and it has its footprint in energy, working through key national institutions such as the Kenya Nuclear Regulatory Authority, the Kenya Bureau of Standards, and the Nuclear Power and Energy Agency. Kenya receives a lot of technical support in developing regulatory framework for radiation and nuclear safety, capacity building, and quality assurance. So Kenya also receives support in insight selection, visibility studies, and environmental assessment. These are partnerships that is not only technical, but it is transformational. This has enabled us as a country a very structured and international compliant development for the Kenya nuclear program. As a government, we are fully committed, DG, to strengthening cancer prevention, screening, and early diagnosis. We are expanding treatment services across all our regions in our country. We are investing in our healthcare workforce, and we are integrating cancer care within our universal health coverage agenda. And I'm sure our community health promoters, muko area leo. I'm sure Governor Sharif Nasir has paid his bit, I pay my bit. Am I right? Sindayo? And come July 1st, you will have a full social health insurance fund, comprehensive. We have agreed with the Council of Governors that because you are the frontline healthcare workers, you do a very great work, both levels of government. We are going to provide the specialized bit of the Social Health Insurance Fund, comprehensive cover. Myself and the PS, we have already put it in the budget, and we expect Governor Sharif Nasir to put in the budget. Secondly, for our UHC staff, you know that you send me a lot of messages. So I have an opportunity to answer you so that you don't send me messages when I'm watching Manu or when I'm in the mosque. We have extended your contract up to 30th of June. And the money is available with the PS Oluga. And the chair of health committee will tell you that on the 1st of July, the whole payroll and your permanent and pensionable will be taken over by our county governments. That is for our UHC staff. DG, you know, in Kenya we have a very good Bill of Rights. So citizens and staff, they engage leaders every night. So I had to make those two items outside the cancer story we're doing today, so that our healthcare workers and our community health promoters know that the Minister of Health and the Chair of Health Committee were in Mombasa today. We recognize that infrastructure alone is not enough. It must be matched with skilled personnel, very strong systems, and sustained partnership. And in all these areas, IAEA has stood firmly with us. To the people of Mombasa and the wider coastal region, this facility belongs to you. It represents dignity, access, and hope. We urge you to seek early screening now available closer to your homes. In closing, allow me once again to express, on behalf of the government of Kenya and the people of Kenya, our deepest gratitude to Rafael Grossi and the International Atomic Energy Agency. Your work is saving lives, your partnership is strengthening nations, and your leadership is shaping a future where advanced medical care is not only a privilege, but a right. Together we are proving that through collaboration, commitment, and compassion, we can overcome even the greatest health challenge of our times.